Hey everybody, thanks for joining today. So I just want to jump on here real quick and start with a live session. Um, Looks like my ban has been lifted again. Go ahead and ask me questions you'd like about COVID or medicine in general, but decided to get back on here because I had a ban happen the second time I did a live session here recently discussing COVID, and that ban has now been lifted. But to talk about some stuff today, Johnson and Johnson has found that having a booster shot for their vaccine is extremely effective and shows a strong boost in the levels of antibodies for those individuals that have Johnson and Johnson. Hey everyone, thanks for joining. If you have questions, go ahead and ask away. You can read some of the information behind me. This is from New York Times regarding COVID. All right, hey everybody. So just starting here, um, talked about Florida. They're for them, the pandemic is actually worse now than it had been in the past, and we're keeping a close eye on that because unfortunately their fourth wave seems to be worse than anything else they've had so far. The World Health Organization is looking at addressing the vaccinations that are available to Latin America. Hey, Scotty Dog Mama from Florida. Thanks for joining today. If you have any questions, let us know. And I see you're in Florida, and I know I've been hearing about from colleagues as well as in the news about how bad it's getting down there. I hope you're staying safe, and feel free to write on here with your experience with what's going on down there in Florida. I hope your relatives, loved ones aren't being affected too much, but if you want to give firsthand accounts of information that's going on down there, feel free to type away and kind of let people know that this is really going on. It's not a hoax. I don't know what else people that are out there need to know that it's not a hoax. I'm sorry to hear that your nephew had just gotten it. Hopefully, he had very mild symptoms and isn't really having any issues, and hopefully, he recovers quickly. So, he's 12. Oh, well, I'm sorry to hear that, and hopefully, he bounces back quickly. The Delta variant seems to be more contagious among kids, but hopefully he won't have much of an issue. Had his first shot. Oh, that's great. Oh, he got his first shot, not COVID. That's great. Well, hopefully he gets his shots done and he'll have his vaccination status up and he'll be safe. Hopefully he doesn't have any real reaction to the shots at all. I've told people before I had Pfizer and my second shot was made me a little sore, mild fever, but nothing too crazy. Oh, so he had his first shot and got COVID. Yeah, unfortunately, that can happen. The first shot offers some immunity, but even after the first shot, it takes several days before you have a good enough antibody response. But he really needs the second shot. But he got his first dose a couple weeks ago. Gotcha. So once his symptoms resolve, and he's probably about 2 weeks is what most people would say for getting his second shot. So hopefully he can go ahead and get his second shot here soon, and hopefully COVID doesn't affect him too bad. I hope he has a speedy recovery. It's really smart. Well, thank you for the kind words, weirdo police one. Just trying to do my part as a physician, giving out information. I know there's a lot of misinformation out there, and I'm not bashing other people. I know it can be contagious to read something on the internet and try to spread that information out there, but the problem is sometimes that information isn't always true. So some people that are against what's going on with the pandemic will spread information that's just not true, and that's sad and can be harmful to people. The line for tests was full of kids. Oh man, I'm sorry to hear that. And that's the issue with the Delta variant. At this time, I don't think the data is pointing that it's more deadly, but the problem is it is more contagious, so it is spreading. And even if the percentages of it harming kids is not increasing or making it more deadly, which is a good thing, we are going to be exposing more children to it with schools reopening and the fact they can spread it easier. But hopefully, like with the previous alpha variant, it won't affect them too much. 007 for real. That's a pretty cool name. I'm glad you got your second shot yesterday. Let's see. Is it okay to take painkillers before receiving the COVID shot? If you're on chronic pain meds, things like oxycodone or whatever for chronic pain, those usually won't have any effect on the shot. There was some conflicting data about taking things like NSAIDs, ibuprofen, Aleve, and how they might affect your body's immune response to the COVID shot. So if you're able to, I would avoid them. And I think the last guidance I had seen regarding that was only take the anti-inflammatories. Now, Tylenol is fine. It's not an anti-inflammatory, but it is help with pain, and it can help with a fever. So that might be your preferred thing if that works for you. But in terms of the NSAIDs, I would avoid them unless you really need them, meaning you had a slight reaction to the shot, which can be expected, mild muscle aches, fever, just mild joint pain. Then maybe you can go ahead and take it. But taking it, what they say prophylactically, meaning ahead of time, trying to prevent those things from happening, you probably don't need to do that. Only treat your symptoms if you get something from the shot. What do I think about the studies that say masks don't really work? Now, unless there's a specific study you can quote, I don't know about a study that's shown a negative side effect. There may have been some smaller studies out there, but all of the larger studies really, especially the ones for hospital workers, show that the individuals that have N95s as well as surgical level masks. I think the numbers are there's like a 92% protection for, 95% protection for N95s, and then like an 88 to 90% protection from a surgical mask. Now, the cloth masks are obviously going to be a little bit less effective, but when you have both or two individuals speaking to each other and both have some type of facial covering at all, it's absolutely better than nothing, but both of them need to be wearing it. So it can be helpful. My COVID shots were made by Jack Daniels. Well, that's pretty funny. Jack Daniels whiskey, that's great. But if you are talking about getting the COVID shot, sailboat Steve, I hope you go ahead and move forward with that and it works out well for you. Why should a healthy person not get vaccinated? Vaccinating people still spread the virus. So, like I've said a couple of times before, it's a numbers game. So even if you're healthy, you still can contract it and spread it with or without the vaccine. But if you get the vaccine, your chances of getting a viral load high enough to be contagious are significantly affected. You will be less likely to be contagious. And just because you don't have any underlying conditions and the chances of you getting a severe reaction from COVID, not the shot, are very low, you still could be that 1 in 1,000 or 1 in 10,000 that could die from COVID. So I still believe, in my personal and professional opinion, that individuals that that are healthy, the benefits will still outweigh the risks. And then also, I've said before, it's not necessarily just about for you per se. It's also the fact that if you don't get the shot and you have a reaction to the virus, you're also allowing the virus to replicate more and more and more. So while you particularly might not be hurt if that virus mutates within you, you might then go and spread it to somebody else. And now this new mutation that occurred that may not have occurred had you been vaccinated might be a significant change. The mutation could be more harmful to the next individuals that get it, or worst case scenario, it mutates enough that your vaccinations are no longer effective, and then we're back to square one. And that's really where I'm coming from. I'm not here to shame individuals, and people are allowed to do what they want. I'm not saying we force vaccinations, but this is just me trying to get information out there. Absolutely, you're welcome. And I've seen a few people thanking me for what I do, and I kind of miss some of them, but absolutely, I'm happy to help. I had COVID. It felt like a mild hangover. It was good in 3 days. Yeah, and like I'm not going to argue with about that. Some people that are healthy, it's going to be either completely asymptomatic or mild symptoms. Now, the only thing I will say, and this is only for your information, not trying to convince you to get the vaccine, is that your natural immunity to being recovering from COVID seems to last for about 3 months. That's what the studies say. Some people are going to have longer immunity or shorter immunity. But what the idea behind it is, not only could you potentially catch the same strain, but you might be more prone to catching a new mutated strain greater than 3 months out. Now, the vaccines seem to have a robust response for 8+ months after the shots you've gotten, and also work pretty well against Delta. So, which arms does one take the shot in? So I tend to get most vaccination shots, meaning the flu shots, and as well as my COVIDs in my left arm, just in case I had a mild reaction, was sore. It didn't affect my dominant arm for any reason in terms of it being overly sore, not being able to do very much. I don't really get a lot of soreness at the site typically, even from the flu shot. I get more of mild general body aches and low-grade fever. But that's just my recommendation. There's no real science to back up which arm is better. It's just more of if you did have significant soreness to the muscle, would it impede your daily life? And most people should probably get their non-dominant arm. Now, for me as an anesthesiologist, it's kind of tough because I do use my left arm to hold what's called a laryngoscope, and that's what we intubate patients with. So even though I'm right hand dominant, I still use my left arm typically at work. Let's see, 2G walk. What about Bam Bam drug? If you could, are you talking about the? I'm not sure what the Bam Bam drug is. If that's an acronym for the monoclonal antibodies, those can be effective, like Regeneron. They seem to be helpful for outpatient treatment and preventing the spread of COVID within a household with others that might not be vaccinated. Vaccination during pregnancy. So, and I've read on this pretty recently. I don't think the guidelines from the American College of Obstetrics and Gynecology have changed, but they were for those individuals that had high risk pregnancies or those that would be high risk for exposure, meaning healthcare workers. So, if you are a high risk individual, and you should talk to your OB, but if you are your benefit would outweigh your risk most of the time, you should go ahead and proceed with it. The issue or the idea of infertility has been completely debunked. There was some evidence initially that there may have been an antibody that could react to some type of placental protein, but that was, like I said, debunked, and that's not really true. I have blood clots in the past. Is this going to give me blood clots? I'm so scared. Tim Talk 971. Yeah, so I'll touch on that a little bit. So individuals that are prone to blood clots, obviously discuss it with your healthcare provider before proceeding, but you do have a small risk from the vaccine of getting a blood clot, significantly less than individuals who take birth control or smoke or those that have had surgery and are immobile, like really significantly less chance. But you also have to weigh in the fact that what if you had COVID? Your chances of getting a blood clot from COVID significantly higher than the chance of blood clot from the vaccination. So again, talk to your healthcare provider, also with what your other comorbidities might be, and figure out what's going to be best for you and your individual situation. That's what I keep saying to everybody. It's always an individual decision. Risk benefits. Your risk benefits will apply to you and only you. Okay, so I just got about there's the vaccination adverse events registry. So 13,000 have died, and obviously any death is awful. We don't want people dying. But when you compare it to not only the amount of vaccinations we've had done and compare that to the amount of individuals that have died from COVID, these numbers are very small. And like I said, each life is important. So 13,000 lives lost is awful regardless. But the thing is, it's all about the probability. How many people are we actually helping by vaccinating? And if you look at the numbers from all the states, we're helping a tremendous amount of people by vaccinating. 90+%, and actually probably 95% of those hospitalized and in the ICU, and you can look this up on several sources online that are running records of this, including information from Johns Hopkins research institutes, that 95% of those individuals that are going to the hospital and in the ICU are unvaccinated. So the vaccine is working, and the chances of you having an adverse event are exceedingly low. I mean, 13,000 individuals, like I said, is awful for people to pass away. No doubt about that. But when you're talking about giving, I guess as billions of doses now of a vaccine, that's still a very low amount of individuals compared to the total amount of people vaccinated. I mean, think about it this way. People pass away from peanut allergies and things like that, anaphylactic reactions from other types of things that are going on. And this percentage of 13,000 out of billions vaccinated is likely less than the percentage of those that would pass away from other drug reactions or any type of allergic reaction from environmental reasons too. Oh, I get this thing all the time. Jason Caraway, how much do you get paid? So in terms of being on TikTok and making these live sessions, I don't make any money off the live sessions, that's for sure. The only thing I get is my other funny content that I create on my page, just like everybody else. I get paid the same amount based on views, but I don't make anything on these, and I'm doing these purely for educational reasons to help those that have questions and want to hear more of this information. Um, these sessions have been banned in the past, so I'm just trying to continue to get on here. Every time they've been banned, I've been able to appeal it, and within 24 hours, it gets reversed. So as you make money off of giving the shot, and so does your hospital, of course you encourage it. Well, again, I've said this numerous times. I don't personally make any money off of any of these things outside of maybe some of retirement funds that are out of my control, meaning the S&P 500 funds that put money into retirement for when I'm 65 years old. They might have stock in Pfizer per se, but I own zero individualized stocks in Pfizer, Moderna, Regeneron, and any of the testing. So no testing, no treatments, and no vaccinations. I don't own any individualized stocks in those. I don't make any money from my hospital. And if anything, I wouldn't, because I'm an anesthesiologist in private practice, and we don't get any of the money that the hospital sees from shots, and they're not even making money off of these shots. They're administering it, trying to protect our individuals and throughout the community. Let's see. Have you heard of side effects of vaccine of hearing loss? The only thing I've really heard of, I haven't heard of hearing loss. Now, I'm not saying it hasn't happened, but definitely not something significant that's caught the eye of the FDA regulators or physicians or healthcare providers across the country. The only thing I've heard of is tinnitus, which is ringing in the ears, and even that's very low. Based on the amount of reports, it's lower than what you see in the generalized population. So even if you're seeing it after you get the COVID vaccine, it's likely not from the shot because it's lower than what you're seeing in the general public. So usually you would see it at higher rates than the general public, so that you can exclude that it's not just by chance alone that these people are getting ringing in their ears. The bald goose. Do you have moderators? I don't, and the only reason I don't is people can say what they want on here, and I don't believe in censorship. Even though people seem to come on here and try and ban my live sessions, which feels a little bit like censorship, I don't. I want people to feel that they're able to write what they want, and I will. I have a lot of comments here, to be honest. I try and see as many as I can and answer as many as I can. Oh, I get this one a lot too. We're the first two vaccines made from aborted embryos. So I wanted to refresh my memory on this. So I actually looked this up today. Now, for a long time, all vaccines have been tested and utilized cells that were obtained from the 1970s from abortion from the Netherlands. And there is a lineage of cells. These are not new cells that are taken from aborted pregnancies now. These were cells that are retained from over 50 years ago that in a lab they are able to replicate to test under laboratory conditions. There's no new life, no new conception that occurs. These are old cell lines that have come along for 50 plus years. And they test within these lineage, but in the actual vaccine, there is absolutely no aborted embryos, and even the testing is not done on aborted embryos. It's just cells that have been replicated from what would have been early embryos from back 50 years ago. So no, there is no new fetal tissue that is used in either the shots or the research of the shots. Let's see here, Mike James. According, I think I answered this one already. The 13,000 deaths. Let's see here. Austin XD96 Pfizer gang. Yeah, that's the one I got. Honestly, I think all of them are very effective, and they work great. The Johnson & Johnson, initially they said was 70% effective, but now, as you can see here, strong boost from the second dose, and likely has great protection against the Delta variant after a booster shot. So if you get any of the shots, you should be rest assured that you're likely protected. Now, with anything, not just vaccinations, but anything in life. None of these are 100%. There's still going to be cases which are labeled as breakthrough, which I think is more of a misnomer. To me, breakthrough sounds like you had some immune response to it, and the virus was able to still overtake you. But most of the time when this is occurring and they're being labeled as breakthrough cases, it means more that the person more than likely falls to that 5 to 10% range of being a non-responder to the vaccine, meaning they didn't really mount enough antibodies. So it was almost as if they didn't receive the vaccine at all. And that happens with all vaccines. This is not new for the COVID vaccine. What about pregnant women and long-term effects for their unborn babies? So I touched a little bit on infertility earlier. That has been completely debunked. They don't see any issues. Recommendations currently for pregnant women, and these are the last ones I had seen from the American College of OB and Gynecology, were high-risk pregnancies and those that are likely to have high exposure to COVID, mainly healthcare workers, nurses, etc., that were pregnant. But again, it depends on other comorbidities you might have and your given situation that you should discuss with your physician. But the long-term effects on the unborn babies, I mean, the vaccine itself, the main substances, not the immune response, but the substances, the mRNA, etc., starts to degrade within a few hours. Most of it's out of your system within 3 days, and then it's definitely gone within 2 weeks. Everything that you would be traced back to the vaccine is gone, except for your immune response. So the antibodies that would fight COVID are still there. The memory within your B cells to make new antibodies if you're exposed to COVID in the future is still there, but any amounts of the vaccine are gone. So to think that something that would be from the vaccine would cause a long-term effect down the road is extremely unlikely. And I had a slide on another live feed that showed in all the history of vaccines, including things like MMR and other non-living vaccines, there's never been a large-scale report, say 5 or 10 years later, that a non-living vaccine has caused some unknown thing. Some people think of here cancer associated with it. I think it's going to modify your DNA. That's not really how messenger RNA works. It doesn't even go into the nucleus. So your nucleus is in the very center of the cell. That's where your DNA is. That's where your own body goes to replicate it, make new cells, etc. The mRNA stays what's called the cytoplasm. That's outside the nucleus, but inside the cell wall. And what happens is the mRNA will go to your ribosomes, which are small structures within the cytoplasm, make the protein or antibody, and then will produce it. But the mRNA is degraded. So there shouldn't be really any long-term effects for yourself or an unborn child. But again, it really comes down to your individual case, and you should always discuss it with your physician. Always change. So this is a very common thing in science. So the science is always changing. You guys flip flop from day to day. How can we trust you? So for the most part, I think our story has been the same most of the time. The vaccine works. Now, as science goes along, it means that we're evolving and learning all the time. Just like that's the whole point of progress in science. It's not that we're trying to mislead or misinform. It's just that new information might pop up that allows us to then change our strategy to better serve the public and individuals. Now, there are small nuances within this, and most of these have come from changes with ivermectin, use it, don't use it, hydroxychloroquine, use it, don't use it, vitamin C, use it, don't use it, etc. But a lot of the vaccination stuff has been relatively the same. There was early concerns, like I said, infertility, that's been debunked to this point, and other issues like that. So the science hasn't changed to the point where there's been dramatic changes where people have been put into harm's way. The only reason some of the things have changed about treatments is that we were in the middle of a pandemic and things were being trialed to help people that were dying. So your margin for risk was a lot higher because lives were being lost before we had the vaccine. So you'll got to remember, you have to look at everything on an individualized basis, risk and benefit. You have people that are dying, then trying to help them. The only bad outcome from your treatment is going to be what would have happened if you didn't intervene. So your threshold for safety versus risk is a lot more narrow then. But when you have a vaccine that's working, and we can roll that out, then you don't want to be doing all these other therapies where you can harm somebody. The vaccine has a very large safety to risk profile, meaning that you'll get the effects of being vaccinated and safe from the virus and very little chance of having a severe reaction. Mike James, I know I've seen your comment about the 13,000 that have died, and I think I've addressed it 2 or 3 times now. Um, how many teenagers have been diagnosed with heart inflammation? I don't know the exact number. I know that there were reports of that. So the thing is, again, this is it's something called myocarditis, inflammation of the heart muscle. But we were also seeing that from COVID itself and in higher rates. So you can't, and also one thing they're looking at now, and teenagers, it might not be as big of a deal because they're larger children. Some of them approach the size of adults, but the one that they're looking at for pediatrics is trying to decrease the dose. So right now, I believe it's 30 micrograms is the amount of amount in the vaccine given to you for an adult. And they're looking at decreasing that dose to somewhere closer to like 10 micrograms, which is about a third of the dose for children. And the aim right now is during those clinical trials, hopefully that 10 micrograms would reduce the effects or negative effects from the vaccination on younger children because they don't need the extra dose, which might cause them harm without increasing the immunization that they're getting. Let's see here. What about natural immunity for people who have had COVID? So yeah, I've answered this a few times in these live sessions and always happy to follow up on that. So natural immunity will kind of wane away after about 3 months or so. Everybody's going to be different. Nobody can tell you for sure how long it's going to last for one given individual. But for overwhelming majority, um, sorry, I'm going to come right back to this. I see this all the time. Survivability rate, 99.975% survivability rate without vaccine. That's just not true. I actually have another graphic I was going to use today, but you can see fatality rates as high as almost 8% in places like Mexico, but there are a slew of other countries that are way far greater than 1% mortality rate. Initially, the mortality rate was underreported when the pandemic started, but that has changed over time. So back to the immunity. So natural immunity lasts for about 3 months, and you likely have pretty good protection from that. So, but after that, it kind of goes away, and you could either be susceptible to the same strain, or more importantly, you could be susceptible to Delta, which has changed, has mutated some. So the main thing is with vaccinations, you get a more robust immune response and it lasts a lot longer. So your antibody levels tend to be higher and they last for about 8 to 9 months or longer. We still don't know because some people, besides the people in the trials, most people have only had, on a large scale, have only had the immunizations for about 8 to 9 months at this time. So we don't know on a grand scale. Now, some of the people in the trial, which had started several months prior to widespread vaccination, have had continued immune responses and higher amounts of antibodies, but it's hard to say about um, the individuals who have had it recently, who are on the scale of millions, as opposed to the tens of thousands of people that had it during a trial. So did the COVID test only test for COVID? Where did the flu go? So the thing about it is, um, the COVID tests did test for the only for COVID. Now there were some that came out that tested simultaneously for flu and COVID, and those were more recent. But uh, when we first started and the test came out and they were looking for COVID, they were looking for COVID. It's very specific, looking at uh, results for COVID, not looking at the flu. So there is a difference between the structure of the flu as well as the COVID structure. So when they're looking at that in a test, they can differentiate that. Now, the next question I typically get is, can you test the difference between an alpha and delta variant? For the most part, when patients come in for us for surgery, we just need to decide whether a patient's positive or not. So our preliminary tests, which are very accurate, decide whether a patient has COVID or not. But the next question is it Delta? Now, if you want to know that, a lot of times, unless you're at a large academic facility, those are send-out tests. So you can differentiate it, but usually you need other type of tests. Not a real doctor paid to push the law. I don't take the poison. You know, everybody keeps talking about the poison and the stigma around it, and that's fine. Again, I'm not here to do that. I am a physician. You can look up who I am. You can go to Johns Hopkins Anesthesia and Critical Care Medicine website. I graduated from the class of 2018. My picture's on there. My name's on there. I also went to Georgetown University for a master's degree in physiology and biophysics. So I do have real credentials, and I'm also not being paid. Especially for live sessions, the only thing I get paid for is just like any other content creator, whether it's medical or not. I get some very small amounts of money for making videos. I mainly make those just to make people laugh and have fun, but it's very small amounts of money. I don't get paid at all to do live sessions. Does this pertain to the Delta variant too? I guess you mean the booster. So Johnson & Johnson seems to have an increase in their immune response, which I don't know for sure about Johnson & Johnson. Likely it's good against Delta. I know Moderna and Pfizer still have pretty good effectiveness against Delta. Now, it is a few percentage points lower than what was touted before. Moderna and Pfizer fell somewhere between 95 and 97% effectiveness against Alpha and the initial variants. But now with the Delta variant, it's likely somewhere in the high 80s, low 90s, but still absolutely better than not being vaccinated. So Summer Dawn 360, this is not 100% true. My mom had COVID in December and still had a large number of antibodies last week. And again, I actually said exactly what you said. I said everybody is going to be different. Now, but the studies that looked at individuals that had natural immunity, the majority of people started to see antibodies falling off at the 3-month mark. Now, like I said, you have a bell-shaped distribution for stuff. So about 95% of people will fall within 2 standard deviations on each side of your average, but you're going to have outliers. Some people will have a great robust response, and I'm glad that your mom still has a large amount of antibodies, but the overwhelming majority of individuals start to have their antibodies fall at about the 3-month mark. Let's see here. So yeah, this is the other thing I was going to talk about today. So people say about the FDA would really approve it if it wasn't legit. So let me just ask a question here. So for those individuals that think that this is being pushed by the elites or there's some other ulterior motive or agenda, and what type of society would be left if all you did was give something that was a poison trying to kill people to high-ranking officials and killing off your entire healthcare workforce? What type of society would you have left? Where would you go if you got sick or injured? It just doesn't make any sense. I mean, why would somebody want to kill off all of these individuals, particularly those that are providing care to those when they get sick or hurt? It just doesn't make much sense that you would make an argument that the vaccinations are meant to kill individuals or they're being pushed, but they're harmful. I mean, some of the physicians and nurses and other healthcare workers, we were some of the first in line, even before a lot of the preliminary information came out. They only had 2 months of data when they got the emergency use authorization. So if there was any inclination that it was going to be harmful, why would they pass it to take out an entire workforce of individuals whose job is to get the society back on their feet when they're sick? I mean, that whole argument does not make any sense to me, to be honest. Let's see here. So informed consent. I don't know what you mean by that. I mean, I'm all for informed consent. I have to get informed consent every single day for procedures and administering anesthesia for patients going in for surgery. I completely agree with that. I think that people should be completely transparent and provide all of the available information to individuals. And when I had my vaccine done, I got about 3 or 4 pages of information about the vaccine that I signed. Um, but they were pretty normal type reactions, things that happen from even similar to our forms when patients going for anesthesia, like type of drug reactions, things that can happen if patients receive blood transfusions, all these reactions that are relatively small, but they are typically included. Let's see here. And we should have the option not to be forced. and I'm not here to talk about people being forced. I agree. I don't think people should be forced, and I'm not advocating for forced vaccination. I'm just on here providing all of the current literature that we have currently, and answering questions for people that are on the fence about vaccination or just people that have questions in general. I am not trying to uh, convince people or force people in any manner at all. Let's see here. Joel Baker, 24. I got epilepsy and it causes epilepsy. What do you suggest? So, I don't know of any data that suggests it causes epilepsy, meaning a lifetime seizure disorder. Now, there may have been case reports of somebody having a seizure from the medication or from the vaccination, but it's not something that, like, I've seen. We get emails regularly from our state departments of health about things that are being monitored, as well as from the federal level, if there's anything that's popping up for vaccines. And I haven't seen anything regarding anything out of the ordinary for seizures. And this is what somebody was talking about before with hearing loss, and I mentioned ringing in the ears or tinnitus. They weren't seeing it at anything higher than the general population. So somebody may have had a seizure, but the question you have to ask is, are individuals that receive the vaccine having it at higher rates than what's common in the generalized public? Because you can't just say that, oh, they had a seizure and had the vaccine, because it might not necessarily have been the vaccine. They may have just been somebody who may have had undiagnosed epilepsy or just had a seizure. It could have been the vaccine too. I'm not saying that it's not from the vaccine in all cases, but you also have to remember that when you're administering a vaccine on this scale to this many people, you're going to see other things that may be from the vaccine or might not be from the vaccine. And as long as it's less than what you're seeing in the generalized public, it's likely, I'm not going to say 100%, but it's likely not statistically significant in the sense that you can't attribute it to the vaccination. Cancer diagnosis rates are up 200% in 2021 year to date. So the thing is, you also have to remember that, well, also you have to remember if it's year to date compared to 2020, most people weren't having screening things done. There was a large drop off in endoscopy procedures. So you have to remember that's where a lot of people go. And it's probably one of the most surveillanced types of cancer for polyps and things like that. And it's also the third leading cause of death from cancer or colon cancer, at least the last time I had looked. So you got to remember that when individuals are foregoing the surveillance procedures, they're not going to get reported. And that was a reason why we had to start trying to find ways that in the setting of COVID, of allowing individuals to come back to get these screening procedures done so that we could find them early and prevent patients from having advanced colorectal cancer because it got missed because they weren't able to have a screening colonoscopy. So you have to take everything in perspective. So if it's compared to 2020, then obviously most things are going to be appearing at higher rates because most people weren't getting screening procedures done because of lockdowns or significant testing and the fact that hospitals were being overrun with COVID in areas, so they didn't have the capacity to be doing these things anyways. Why do you need to take the vax if you've already had COVID? So I kind of discussed this earlier. Um, Basically, 3 months of natural, and this is not for everybody, and I just had this discussion with somebody else, but 3 months of natural immunity after infection is about what you get, plus minus some time. Some individuals might have shorter, some individuals may have a lot longer of immunity, but it's much more predictable long-term immunization and higher immunity levels when you get the vaccine, 8+ months. So the booster might be indicated for those that are immunocompromised or potentially healthcare workers, but for the most part, it seems that the immune response is much more robust as well as has longer longevity for the antibody levels. Fix my skull cap. Is that better for you? There we go. All right. Have they completed clinical trials, and if not, what are the possible repercussions? So they had initial clinical trials a long time ago, phase 3 trials, and then when they were able to secure what's called the EUA or emergency use authorization for the vaccines, they had a smaller amount of data available of about 2 months. But because so many people were dying and we needed to do something, they allowed them to have emergency use. And then fast forward several months later, when we have about almost a full year of data that the FDA was able to personally go back and review. They redid all of the calculations to look at the safety and effectiveness of the vaccine. And when that happened, they found that it was just as advertised. It was safe and effective, and that's why Pfizer recently was full FDA approval after a thorough investigation of now much more available data. They were able to proceed with full approval. I just saw somebody said they have a PFO, which is a small hole in the heart between the right and left atrium, the two top chambers of the heart. Concern there is blood clots can travel across the heart and then go up to the brain and cause strokes or go anywhere else in the body, but major concern, stroke. And this is kind of the same thing for individuals who have a history of blood clots. It's always an individual basis, but your chances of getting a blood clot from the COVID vaccine are lower than if you got COVID. So if you get COVID, your chances of getting a blood clot are significantly higher. So if you're going to weigh those two things, you're most likely going to benefit more from getting the vaccine with a lower rate of getting a blood clot. But again, I would talk to your physician, particularly the one that manages any blood thinners you're likely on, and get their input. Which vaccine is best for a 25-year-old healthy male? Or meal, I think you meant male. Uh, Honestly, any of them. For healthy 25-year-olds that are out in just the generalized public, not in healthcare, Johnson and Johnson now with the booster is great. But even before, even with 70% effective for the regular community who's not in healthcare, not exposed to high doses of COVID, being in an ICU unit, things like that, where patients are just severely sick with a lot of virus present in the room, that's completely fine for the generalized public. Now with the booster shot, it has great levels of immunization. But Pfizer and Moderna, no difference. I mean, they're basically a toss up, whatever's available. But I think if you can get any of the three, they're fine. Let's see here. May have answered this. What if I already had COVID? Yeah, I kind of touched on that already. But basically, 3 months of immunity um, from natural immunity, it kind of goes away. You're going to have much longer um, immunization from the shots, so the vaccines. So that's the main reason to get it. And as long as you didn't have severe reaction, meaning ICU, and didn't receive Regeneron, the antibodies, monoclonal antibodies as treatment, most people can get it within 2 weeks or so, about 2 weeks after resolution of symptoms. And if you did receive the antibodies I was discussing, check with your healthcare providers, but it's usually about 90 days later when you can start taking the vaccine. So antibody titers. So there is an established range. I don't know the exact numbers, but there is a range of what's considered a good level. The only problem is you can fall within that number, but you don't also know, you need to trend it. So in the trials, they looked at trends, So if somebody was really high and then petering off, then you know that their immunity is starting to wane. But if you take one snapshot at one given time, it might appear that you're having high levels now. But if you're tapering off, then you might be a candidate for a booster shot. So I don't know I don't really know how to guide boosters. I don't think anybody does right now outside of the immunocompromised population, and where the role of testing for antibodies will fall. Maybe that will be something that we'll look at in the future once it becomes more standardized and we can follow that. But for the meantime, the vaccines seem to work great, and we can see that by the hospitalization numbers. I just saw something on here. Another paid doctor spreading BS. Pat Ryan 3365. That's cool, man. You can think what you want. I make zero money on here. Full disclosures, I have no individual holdings in Pfizer, Moderna, Regeneron, or any of the testing companies at all. I don't make any money on these live sessions whatsoever. So you can say what you want about that. All right. So a few more questions here, and then I'm going to jump off here. Let me see here. There's one more here. causing blood clots and other serious side effects as well as death. So the rates of death are exceedingly low. I will say that I said this before. We don't want people obviously passing away, regardless of, whether it's from the vaccine or anything. But we also have to look at it in the spectrum of what's going on. And the benefits of getting vaccinated, reducing the chances of being sick, spreading it, being the source of a significant mutation and hospitalization, etc., all has, without doubt, outweighs the risks of the vaccinations. And then if you throw in the fact that if you do get COVID, the risks from COVID are significantly higher than from the vaccine. So the whole argument of people being sick, and even the stuff that's been reported, the rates of complications from the vaccine are lower than what we see in the generalized public. So for the most part, the vaccine is likely not the cause of these things. Now, the myocarditis might be the only thing that there has been a link where there's been some inflammation of the heart. And now I can't tell you the exact mechanism, but for some reason, it seems to like to go into the heart muscle and cause an inflammatory response. And that's why it's causing injury to the heart muscle. Let's see. Yeah, not getting it. And that's fine. I mean, I don't understand why people feel the need to get on here and tell me they're still not getting it. I'm not here to try and force vaccinations or convince you. I'm just providing people that are interested in knowing the information we have. I wish you the best. I hope that you don't have any issues with COVID and you don't have to get the shot. I'm not here to say that. So the monoclonal antibodies, so that's so the Regeneron and those type of things, they seem to be effective for outpatient, more of outpatient treatment. They may have a role in hospital and for inpatients, but it doesn't seem to help out very much with those that are in the ICU and the ones that are really sick. It does seem to potentially help prevent the spread of COVID in an outpatient setting for others to others that are inside their home. Uh, Penny Deplore, sorry if I'm pronouncing your last name wrong. Thank you for sharing information. You're welcome. Just hopefully here to help and spread um, information that we have. Tell us more about the Delta. So the thing about Delta is that it seems to be more contagious. The jury's still out on whether it's more deadly per se, but whenever something becomes more contagious, you're now putting more people in the eligible pool of getting an infection. So even if the percentage of people that are dying doesn't change, you're now exposing more people that may have not caught it before. So that's where the issue is. Majority of society's immune system is more effective than the vaccine. I don't know how you can say that with any certainty. I mean, look at what happened throughout the pandemic before the vaccination. I mean, we were having a problem. People were dying. What was killing all of these people then? I don't understand where that logic would come from. I mean, if our natural immunities were working so well, why were so many people dying? It just wouldn't make any sense. All right. Well, underlying conditions. So, I mean, it depends on what the underlying conditions are for people, but anybody who has intrinsic lung disease, smokers, diabetes, things that are going to make you harder to fight an infection or heal are likely going to benefit a lot from the vaccinations. Which do I recommend? Honestly, any of them. Whatever's available to you is fine. I myself had Pfizer. I have family members and other people that have had Moderna, and I know people that have had Johnson and Johnson, and they've done fine. So it's really not a question of which one you can get. It's just if you can get any of them, that you should do just fine with it. All right. Well, I'm gonna go ahead and sign off here. I got a couple things to do, but I hope you all stay safe. And if you get the vaccine, that's great. For those that don't decide not to get the vaccine, then I wish you the best. Hope you don't come in contact with it, or if you do, I hope it's a very mild case for you. But everybody stay safe out there. Have a good day. Thank you all.